Thank you for good words, warm words, Professor Morozov. So, I know you are all tired. I'll try to be fast. I want to talk about the possibilities of the pharmaceutical firms in providing mental health reforms, particularly in Georgia, and I think also what I will talk about is also very typical for many countries of post-Soviet region. What we have today is a worsened version of Soviet-type psychiatric system. What existed 25 years before gradually worsened. There was a constant decrease in number of beds, some degradation of psychoneurological dispensaries, and no mental health, community care, and evidence-based practices were formed instead. We have no residential facilities, and so many patients for years, some of them 15, 20 years, stay in hospitals, and almost no outreach services and very poor rehabilitation service. I remember what Mario May, the past president of World Psychiatric Association, said in 2011. He was admitting that the quality of psychiatric care is proportional to the number of psychiatrists involved in a service. And here too we don't have a good picture because there are only 169 psychiatrists involved in psychiatric practice funded by state. This means that there are 4 psychiatrists on 100,000 of population. To compare it with the average number of the average European number, it's 6, so we have less, and we are moving gradually towards the number which is typical for some African countries, with 1 psychiatrist at 100,000 population. And we have also a lack of psychologists in the service, and almost no social workers, and also there's a lack of nurses. So we have 32 beds per 100,000 citizens. Again, to compare it with the European data, in Europe it is about 80, maybe from 50 to 90, but on average 70, 80 beds per 100,000 population. And we have 15 dispensaries which are the heritage, again the Soviet heritage. These are kind of outpatient clinics. Another resource which is very important for treatment and caregiving is money, which is never enough. We have the estimated number of Georgian population, 4.5 million. And if we take into consideration WHO's data about the possible number of people having psychiatric illness, it is 27%, more than 1/4 of the adult population between the age of 18 and 65 can have some kind of diagnosable psychiatric problem. And if we add here also the problems of the pediatric and geriatric patients, of course the number can be much higher. But what we have in fact are only 80,000 patients registered at as this service provider, as the service users. This means that almost 92% of the possible service users either do not get psychiatric service, or what happens with them nobody knows. State budget is about $7 million, and it is spent for both hospital treatment and outpatient treatment. Here we have a big disbalance between the financing of outpatient treatment and inpatient treatment, and the difference you see is 1 to 50. I mean, on average, $12 per month is spent for outpatients and about $500 for inpatients during 2 weeks stay in acute wards of psychiatric clinic. And one bad thing what we have is that most of the insurance companies refuse to pay for psychiatric treatment. 3 years ago, several new wards were opened, and in this new condition, in a condition of a better financing, people prefer to go to hospital because they get there much better medication than they can get at the dispensary. And this results in very low number of contacts with the dispensary. From those 80,000 registered, which is already 1/10 part of the possible users of the service, only 12,500 contacts are registered every month. These are people who use outpatient services regularly, and others do not use this service regularly. So this results in increase of rehospitalization. If a patient or a family has to choose between a better service in a hospital or a worse service at the outpatient facility, they choose to go to the renovated hospital and get there much better treatment. And that means that the government has to add every year in October, in November, has to add $1 more million to the existing budget allocated for inpatient treatment. Now, from those $500, which is usually spent for 2 weeks stay in a hospital, around $70 are spent on medication. And if we compare it to the amount of medication which is spent during 1 month in a dispensary, it is again 10 or 12 times less. Usually it's not more than $6 per month. This is a very small amount. It's impossible to buy a normal medication with that amount of money. We have a couple of new services, outpatient services. Crisis intervention service is financed by state. Recently it was put in a state program, and we see that if a patient is provided with a normal quantity and quality of medication, then the average cost of it is $35. It's 6 times more than provided for most of the outpatients. And we have also assertive community treatment, which is not financed by state yet. I myself is working in this service, and we spent even more. So this means that there is a very large market for the pharmaceutical companies, which is empty, and nobody can provide the patients with the medication they need. We are in a lose-lose situation, so all participants are in a lose situation. For example, Ministry of Health has to pay more for in-hospital treatment if they do not increase budget of the outpatient treatment. For years, I myself and several of my colleagues try to explain that if it is impossible to treat a patient with that amount of money outside the hospital, it's better to increase a little bit financing of the outpatient system, and then it will enable them to avoid the most expensive type of service, which is hospital treatment. The service users and their families have inability to get quality treatment in community and have no chance to avoid hospitalization. And this increases the rate of disability because during all year the patients go inside hospital, stay there 2 weeks, then go outside, and after some time go again inside hospital. So it's a constant evil chain which is never interrupted. Specialists have big concern how to keep remission without having possibility to prescribe the necessary medication. Very often pharmaceutical companies invest in seminars, in education, in advertising new products, but they never work on providing us possibility to use all those medication. I can know what is better for a patient, but I cannot prescribe this medication, and many of them have to use just the cheapest type of drugs. Pharmaceutical companies, so I think, if they have problems in selling their products, one of the reasons is that they never concentrate on this issue. Who is responsible in this situation? Of course, all four parties have their responsibility. In the ministry, unfortunately, there's a lack of responsibility to take decision and a lack of competency. And the mental health specialists are, unfortunately, the first hindrance and sometimes the biggest hindrance on the way of change. Service users and their families, they often even do not know what they deserve, what they can ask, for what they can ask the government. There was recently a study made in several regions of Georgia, and it was checked whether the level of satisfaction with the psychiatric service. And it's funny that when we compared the results of this study, we saw that in some regions, Georgian patients and their families are more satisfied with the existing service than patients and families in some of Northern European countries, which is of course absurd. The reason is that simply they have no idea what type of services they can have and what state can offer them for their well-being. So again, the responsibility of pharmaceutical firms is that they usually concentrate on the new medication and never on the mental health reform, never on a legislation or regulation which will enable the patients to use all those brilliant new medication. So if they only educate psychiatrists, this will this is both for this is bad for all four participants of this problem. How to change the situation? I remember here the Professor Morozov. Maybe you help me in translation. The Russian tale "Lebedь, rak da щука," when when all all members of the company try to pull one and the same thing to himself, and this thing cannot be moved from a place where it is lying. So the opposite of this is synergy. That means that if we combine our efforts, then the result will be more than just sum of the individual effects of individual participants. What are main challenges? This is strengthening users and families. They need to know what possible services they can have and how they can ask state about them. They are used to paternalistic, very vertical approach with the state, as if someone gives order and they have to obey, and they need much more information. Educational specialists, of course, this is very important. And I think the most important thing is the capacity building of decision makers. Here, I think the participation of pharmaceutical companies is very important. First of all, they need to be better informed about actual situation of mental health. They need to have idea not only about the products they have to advertise, but about the needs of the population and of the service users, as well of the service providers. But there's a problem how to use finances of pharmaceutical companies for capacity building of decision makers. Usually, all members of the ministry try to stay far from these companies because they are afraid that someone can say that they are corrupted. Well, this is a problem, but I think that professional societies can play here roles of mediators. It's much more easier for the government representatives to cooperate with the societies of psychiatrists, for example, or other NGOs in the field. So then I hope we can reach the win-win situation where users get better service, state has more cost-effective system for mental health, pharmaceutical companies get more income, and mental health specialists deserve paradise. Thank you.